Well, now I'm going to ask a dear friend and colleague who, again, many of you know, to come on up while Kelly does some work on our slides for us. And Emily Dossett was also a member of the California Commission and is a reproductive psychiatrist. And we'll go ahead and jump into our work. But Emily, do you want to say anything generally about your work as a reproductive psychiatrist before we jump in? I didn't tell her to prepare for that.
She didn't tell me that part. So I'm a reproductive psychiatrist. So what that means is that I trained as a general adult psychiatrist, medical school residency, and then I focus on working with women who have any kind of psychiatric issue that intersects with reproductive change. So 90% of my work is pregnancy and postpartum. We do a little bit of work around menstrual cycle, perimenopause, female-specific cancers, but really my bread and butter is working with women who are pregnant and postpartum. And it's a privilege, and I've done it now for almost 10 years and have gotten to know many of you in the room through that and count it a privilege to be a part of this community.
Great. Well, you're gonna stay right here with me, Missy. We're going to go over the results of the California findings, and we're really just here today to give you a sneak peek. But before we go into, let me just go back. Yep, there we go. Let me quickly acknowledge, I think one of our funders is actually watching, so I need to mention that we're grateful for the funding from the California Endowment. We're here at the California Endowment Center now. We received funding for some of this work here in California, and also the California Healthcare Foundation truly could not have done the work without their financial support. And I'd like to just ask you, there's some really interesting and compelling facts on the screen. Did you know that 1 in 8 births in the United States happen here in California? Did you know that? Mind-boggling, right? Did you know that California has the highest rate of poverty in the nation? Did you know that California is the world's 6th largest economy? Why do we tell you all of this, right? Because if we can figure it out here, we can figure it out anywhere, right? This report is going to be important. We also wanted to share, we're giving you a sneak peek of the California findings today, but we really do need you in person at the state capitol on March 1st. All of you in California, we need you. This was an event, and you recognize Raul, whose birthday is today, several years ago, and we want to have even more people at our event at the Capitol. We're also going to be launching a campaign, an email campaign this week to invite all of you that live in California to outreach by a few pushes of a button your legislators in California to urge them to show up to the hearing. So we need you to do that. You'll have an opportunity to customize your message to your legislator if you want to share a personal story, talk about your profession and why this matters to you. So please consider doing that, and we really do want to see you all in Sacramento on the 1st. So I'm going to start with what we call the endgame. So what is the goal in California? What do we really want to see? And then the recommendations we're going to touch on today will lead up to this goal. So the commission said we want to set a very aggressive goal, and that is to see 100% of women screened by the year 2025. And our intermediary goal, 80% of women screened by the year 2021. So we're 4 years off, right? A really big goal, and there's recognition that there's a lot of work to do and a lot of people that need to make a commitment. We also wanted to emphasize that when we talk about screening, we're lifting up the OBGYN as the home base for mother, and we'll get into that in just a moment, but basically recognizing that many women are suffering from depression before pregnancy. We need to catch that, right? And talk to mom preconception, interconception, and also be screening during pregnancy as well. And the best place, of course, for that work to happen is in an OBGYN setting. We also, though, recognize that there should be no wrong door for screening, that anyone in a provider's shoes should be in a position to detect and screen for depression, anxiety, and psychosis. bipolar disorder. All right, so we're going to jump in, and I'm going to go over this page, a quick overview of the recommendations, and then we're going to get into a little bit more detail for each of them. So our 5 broad categories in California for change include, number 1, the fact that all women need more education and support, right? More education about maternal mental health disorders and a whole lot more support during the perinatal period. Number 2, providers need referral pathways. If they're going to screen, they need help with what to do. They need capacity, so their OBGYNs in particular suffer very high levels of burnout already. So how do we support them in screening, right? And more support. Number 3, the need to integrate mental health and medical care systems. This one's interesting. We've got an idea that we want to share that we'll get to in just a moment. And you can see the point in italics underneath that. Number 3 is that we don't want mental health care to be any different than heart health care, right? Mental health is carved out and kind of treated differently than the rest of the body, and we don't want to see that happen any longer. Number 4, the need for measurement. So unless we're measuring how often providers are screening and publicly reporting those rates, nothing will likely change, right? We don't prioritize things that we don't realize are a problem. And then number 5, we recognize that every stakeholder in the healthcare system needs to play a critical role, and everyone must do something to change the dynamic. Emily.
Okay, so just to talk in a little more detail about these recommendations. So the first one is that all women need more maternal mental health education and support. And one thing we talked about is that given the rate of poverty in the state of California, and particularly here in Los Angeles, part of that support is not only mental health support, but basic life needs support. Because a lot of the women that I work at County USC, maybe 2 miles that way, and a lot of women there are homeless. A lot of women there have housing insecurity, food insecurity. A lot of them are really struggling to meet their basic needs. And we can try and address the mental health issues, but it comes as part of an overall package that's actually much bigger. Not that every woman needs those needs addressed, but some do. I actually had a patient last week in clinic. She came to our OB clinic. We worked with her during pregnancy. Then she delivered her baby, and we have an integrated pediatric clinic where we worked with her there. She's about a month postpartum. She's depressed and has a lot of trauma in her life. And I went in and sat down with her after the residents had finished their evaluation. And I said, what do you really need? Like, just if you could say it in a couple words, what do you really need? And she totally surprised me. She said, I need a place to live. And I was like, oh, okay. So we don't need to up the Zoloft, and we don't need to connect you to therapy. We do need to do those things, but she was homeless and renting a room from a friend who really wanted her out. And that was what she was stressed about. So that is very important. The life course model was talked about last year at this conference, if you were here, and the social determinants of health model are really kind of public health ideas that say that maternal mental health is part of a much bigger picture, both in terms of the life course of the mother and their child, and that where we live impacts greatly how we thrive. So I won't belabor those points, but it's worth reading to check out some of those. The last thing I want to say about community coalitions, I'm going to skip over peer support. I think that's pretty self-explanatory. But one thing that came along with community coalitions was the need for, especially in a state like California, local county-based or several county-based networks of people who are passionate about this, can network together, collate resources, and move the work forward. And Maternal Mental Health Now, which is here, is one of the best examples of that here in LA County. So I know there are directors here. If you have questions, they're an excellent resource. Okay, providers find referral pathways, capacity, and support. My entire career is based on the fact that other psychiatrists take all their patients off meds when they get pregnant. That's not good. Good for me, not good for the rest of the world. But it's true, because in psychiatric training, we get nothing, literally nothing, unless you happen to train in a place who has someone on staff who cares about this, about taking care of these women, and it's a big problem. So we need to address this in terms of education. We need to come up with novel, cost-effective, immediately accessible ways of providing that support. These are just some of the ideas there. And as part of our commission, we came up with specific core competencies that every profession, every branch of specialty that works with a perinatal woman should leave their training feeling good about, so that that provider can manage these women. So I'll be around afterwards if you have questions about any of those, but I know our time is short.
Yeah, and you'll have to come up March 1st to get your hands on those core competencies. They include core competencies for lactation consultants, nurse practitioners, midwives, and others. So just quickly, again, to give you some highlights, this need to integrate mental health and medical care. And we recognize and lift up the fact that really what needs to happen is our insurance system needs to become integrated. And the fact that we struggle to integrate medical care and mental health care really is dependent on this fragmented insurance system where employers and individuals are offered medical care plan and then mental health is optional, right? We would never do that for heart health care. And we're saying don't treat it any different. And insurers, you start to integrate your companies, don't have two separate companies, integrate your provider networks so your hospitals can receive reimbursement for mental health care, for example, and not have to bill a separate insurance company. So give you an idea of what we're talking about there. It starts with the integrating insurance systems. The rest we think will fall into place. And then number 4, we talked about the fact that if we don't measure screening and report screening, then our systems don't know that there's a problem. There's already a system in place for that measurement, and it's called HEDIS, and we won't go into detail about that. But the rate that we're suggesting are a measure that already exists and was developed by the American College of Obstetrics and Gynecology, the American Medical Association, and the National Committee for Quality Assurance that accredits insurance companies, developed a measure, but it was never implemented. And we're saying implement that, and please do it ASAP, not just here, but nationwide. The last detailed recommendation that we wanted to go over is that we recognize all stakeholders play a role, and we specifically in our paper indicate exactly what each stakeholder group should do, including state agencies, including the lactation field, including the pediatric field, including the American Psychiatric Association, and others. So we're really excited about being able to provide that framework that's been vetted by this expert group. So next steps, again, the unveiling will happen March 1st. We're going to be doing a picture on the Capitol steps, just like you saw with Raul. Greg here with us today is actually going to be sharing his story. Greg, can you just turn around and wave again so everybody knows? And so we'll get to hear Greg's story on March 1st. And then again, we want you to help us get the word out to your legislators here in California. We'll also be leading up that March 1st work with a social media campaign, and we ask that you keep your antenna up and go to the 2020 Mom social media pages so that you can start to share images leading up to March 1st and a couple images after that as well. Then we also wanted to share what we felt really knew would be really important was that we don't just issue this paper and then walk away. And so there's been a whole implementation plan that we're working on. We have already formed a legislative working group in September, who I pointed out earlier, along with a couple members of our task force, have already introduced legislation. So we'll talk more about that legislation at the hearing. And there will be a steering committee made up of some of the members of the commission that will oversee implementation. Additional funding will be sought to sort of monitor and support the groups that we think are critical to see those outcomes changed by the year 2021 and 2025. We'll also have check-ins with the public. So we'll open up phone calls and have all of you, give you an opportunity to call in and learn about what's happening, ask questions, share your ideas as well. Want to make sure that we're very transparent about that. That's what's happening in California. You can get your hands on the report, the full report, on March 1st in Sacramento, and then later on our website.